Welcome back to the channel. My name is David Osuji, a psychiatric mental health nurse practitioner in the Dallas area. This is part 2 of my video series on the GLP-1 medications, Ozempic/Wegovy, and the rest of them. This time, we're focusing on the mental health-related side effects that could come with this medication. Quick disclaimer, this is just educational content. Please consult with your healthcare provider for treatment/diagnosis. So a patient told me recently, I've lost about 15 pounds on Ozempic, but I also lost something else. I don't feel like myself anymore. Before we dive into it, quick preview of what we're going to be covering today. Emotional numbness, which affects roughly about 5 to 15% of people who take these medications. Mood swings from rapid body changes, unexpected anxiety spikes, and social withdrawal patterns. If you have felt emotionally different on weight loss medications, vote in the comments. Thumbs up for yes and thumbs down for no. So, if your emotional compass feels off after starting one of the GLP-1 medications, this video breaks down what might be happening and what you can do about it. In part 1, I explained how Semaglutide can impact your brain, not just your appetite. Now, let's be crystal clear about something. For most people, GLP-1 medications are safe and effective. The psychiatric side effects we're discussing today are relatively uncommon, but important to recognize. Here's what the research shows. Most users experience improved mood from weight loss. Emotional side effects occur in roughly 5 to 15% of users, and these effects are often manageable with proper support. But here's the thing. If you're in that percentage of people experiencing these side effects that we're talking about today, you deserve to understand what's happening and know that you're not alone. So, risk number 1 with these medications is emotional flatness or emotional numbness. And like I mentioned before, 5 to 15% of users experience this. So it's not very common. Some people describe, I'm not sad, I just don't feel anything. Life's not bad, but it's kind of muted. This is called emotional blunting. Now the question is, why might it be happening? GLP-1 receptors are present in the brain in areas that influence mood regulation, potentially affecting neurotransmitters like dopamine. Think of your emotional volume dial being turned down from like a 7 to a 3. Important context. Rapid weight loss from any cause can temporarily affect your mood as your brain adjusts to the emotional changes. So for those with a history of depression, this emotional flatness might feel familiar, like an old pattern that is making a comeback. Risk number 2, identity whiplash from so many changes. We could consider this as when your body is changing so fast that your mind is trying to keep up. See, your body changes in weeks, but your emotional identity, that takes months to catch up. The disconnect creates physical confidence, but emotional uncertainty. Feeling successful, but somewhat lost. Old coping mechanisms suddenly become irrelevant. See, this is especially challenging for people with past eating disorders, body dysmorphia history, trauma around weight or control. Here's what I wish more providers would discuss upfront. Weight loss success does not necessarily mean emotional well-being success. When your body transforms rapidly, your brain needs time to update its internal map of who you are. That lag period, it can feel like something's wrong with you. It's not you. Your brain is just recalibrating and you need time. But recognizing this pattern can help you navigate it a little more skillfully. Risk number 3, unexpected anxiety. See, some patients report feeling more anxious, not less. They are jittery without any cause, racing heart, restlessness that they cannot explain. Potentially what could be causing this is GLP-1 medications influence the limbic system, your brain's stress response center. For anxiety-sensitive individuals, this could amplify rather than calm down your nervous system. See, this isn't universal. Many people feel less anxious as they lose weight. But if you're experiencing increased anxiety, it is worth discussing with your provider. Risk number 4, social and emotional withdrawal. For some people, food was their primary emotional outlet, social activity, and reward system. So when that suddenly goes away, they don't just eat less, they also engage less. They have declining social invitations because nobody's eating. They have a loss of interest in activities, and life gradually shrinks. This isn't laziness or depression necessarily. It's just your brain saying, my main coping tool is gone. Now what? So let's talk about actionable steps. You don't have to choose between physical progress and emotional well-being. Here are some steps that you can take. Number 1, talk to your provider. Talk to the prescriber about the dose. Maybe you guys can make some adjustments. Number 2, consider therapy support. CBT, cognitive behavioral therapy, or DBT, dialectical behavioral therapy, has been shown to provide support for emotional regulation. 3, rebuild your emotional outlets that don't involve food. Number 4, monitor your mood. And this is really easy to do if you just keep a daily diary where you track your mood. Lifestyle factors that can help. Number 1, regular exercise, right? We always come back to exercise because regular exercise is going to boost the natural mood chemicals that your body/your brain can make. Number 2, mindfulness practices. Mindfulness practices will allow you to stay grounded and present in the moment. Number 3, strong social support networks. These will allow you to break out of that isolation, that withdrawal that can creep in. And number 4, adequate sleep. 7 to 9 hours of sleep daily or nightly can help ensure that you are resetting daily. Remember, these side effects are often temporary as your brain adapts. The bottom line is this: GLP-1 medications help millions of people improve their health and the quality of life. But your emotional well-being matters just as much as the number on the scale. You deserve support that honors your full complexity, your body, your mind, and everything in between. If you're experiencing these side effects, you're not broken, you're not alone, you have options. Subscribe for part 3 on these videos. Next week, I'm sharing my clinical playbook for preventing emotional side effects with GLP-1 medications, including specific supplements that may help, timing strategies for doses, emotional regulation techniques, and warning signs to watch out for. Hit the notification bell so you don't miss it. See you then.